It will be several weeks before the 12-week abortion restrictions begin, but we're already seeing how the new law will affect North Carolina. Thank you for joining us. I'm Gerald Owens.
And I'm Deborah Morgan. We're getting a better picture of what it means for clinics, doctors, and the women they treat. WRAL's Chelsea Donovan joins us now live. And Chelsea, you spoke to a doctor and a clinic volunteer.
Yeah, that's right, Deborah. Many physicians that I spoke to today that perform abortions are expressing concern tonight, along with organizations that try to help women find safe abortion care. They both believe now there are too many hurdles and hoops to jump through that just add more stress, and safe care is simply out of reach.
So as an OBGYN, as a native North Carolinian, as a mother, I'm devastated by this bill.
Dr. Beverly Gray is a Duke clinician who currently provides abortions past the 12-week mark. She has concerns about what lies ahead for her practice and her patients now that Senate Bill 20 has passed.
The House has overridden the governor's veto and the bill becomes law.
46 pages to now try to digest.
I was not anticipating needing to have a law degree to be able to do my job.
This new law has many facets. It would repeal the current law that bans most abortions after 20 weeks and will instead put in place a 12-week ban, a huge health issue, says Dr. Gray.
When patients first find out they're pregnant, they don't have a crystal ball to be able to say this is going to happen when I turn 12 weeks or when I turn 13 weeks.
A phone consultation required by current law at least 72 hours before an abortion now has to happen in person under the new law, and first of 2 abortion pills have to be administered in a medical practice as well. The new law also adds a post-abortion doctor's appointment.
We have 9 counties where abortion care is provided in North Carolina. And if you live in a rural area and need to travel for care and you want a medication abortion, that requires 3 in-person visits.
The Triangle Abortion Access Coalition helps patients access abortion care in the state or out of state, and they believe these appointments will also be an added burden.
They're going to have to plan more time away from home, their jobs, their families. They're facing travel out of state, potentially Virginia or further.
Now, we should mention in case of rape or incest that abortions would still be allowed through 20 weeks of pregnancy. If the fetus has a life-limiting anomaly, abortions would still be legal in our state through 24 weeks.
Chelsea Donovan live in Raleigh. Thank you, Chelsea.